Um, I've always been an idea guy. And sitting in the OR talking a lot to doctors and just listening to healthcare and some of the concerns that physicians and other staff had voiced through the years. And finally just picked up the phone after in between one of my cases one day and just called the switchboard operator at that time of Methodist Hospital, which is where the executives were for Clarion at that time, and asked to be connected to the CEO, Dan Evans, and got through to Dan. Happened to be in town and took my call and just said, you know, Phil Dulberger, I'm an anesthesiologist. I have an idea about a different way to deliver health care. And traditionally, where hospitals wait for people to get sick to come in, if we could establish a campus that focuses on keeping people well, I know that seems like an oxymoron to a hospital system, but the idea is if we could partner with patients to help them stay well, better lifestyles, healthier lifestyles, when they do get sick, you're committed to them and they're committed to you as a health partner. And traditionally, someone comes in and they say, I'll use you as an example, you know, Mr. Britt, you've got borderline blood sugar or borderline blood pressure. You know, traditionally we pull out a script pad and write 2 scripts, hand them to you and send you on your way and say, come back in 6 months and we'll take a look. In this model, you would say, you know, Mr. Brett, why don't we're working closely with the fitness facility here connected to our building, and we have built certain programs to help you, you know, lose some weight. So, but the idea would be then we would send someone downstairs, they would engage in some type of a wellness program, have them come back, get affirmation from the physician, you know, Mr. Britt, you've lost 10 pounds, your blood pressure's down, your sugar's down, we don't need to do anything, congratulations. It's reaffirming to you so that you're living a lifestyle now that's better for you, healthier for you and your family. And that's, you know, you look at statistics around America, we're one of the most obese nations in the world. I mean, this is how we as a health system would then start to reach out and partner with the community. Yeah, I think that's the core value. You know, you think about that in any successful business venture. You know, Southwest Airlines, I was reading about them, but how do you want to be treated as a customer, you know, or a passenger in Southwest? How do you want to be treated as a patient or as a guest? I like to actually refer to our patients as guests. It gives us a different mindset and keeps us in touch with that experience concept. So that's a mantra that we're using here and across IU Health is more around patient experience. So exactly what you said is, how would you want to be treated? And you know, I encourage people to think of a loved one and on the other side of their caring hand saying, you know, how would you want your mother, father, or loved one treated? Form follows function. So first, you have to design the facility to allow you to achieve that. And then secondly, you have to pump the life through the facility, which is our resources or our staff partners, to make sure that they're carrying out that vision of preeminence and that experience. So you can have a beautiful facility, but if you have a bad, you know, kind of personnel, then you're not going to end up with a great experience. So the goal would be to have people walk out of here and say that didn't feel like a hospital. That was an experience, and they really felt like a partner in my care process. Clinical care is where my passion is. So we're back into what the original intent was 6 years ago during that phone call is now, you know, caring for patients. There's a passion for continuing because of the economic changes in the environment, some of the original design of the fitness facility, things like that. And I'd like to see that brought in as well. But yeah, I do see myself doing this. I like interacting with people. I like problem solving. I like system type thinking. So I'm very blessed to be in IU Health and the opportunities that it brings.